So there's many ways of helping. I think a lot of times when we talk about helping, we automatically think, of the big impact. How can I do it as big as somebody else? Well, you're not that person, and I think that it's really important that we take on the responsibility of just understanding that helping one person is as important as me being capable of helping 20 or 30,000 kids.
That's former NBA All-Star Luol Deng with us this week, giving those in the diaspora tips on what steps they can take when trying to help people back in the motherland during the current COVID-19 pandemic. That's coming up in the show. What happens when an enemy attacks viciously without discriminations across ethnicities, clans, economic status, and political lining? People fight back with all they have. In Africa, more than 8,000 people are known to have died so far. Some individuals as well as corporations have declared war against COVID-19, stating, "The virus is attacking our economy by extinction. We win by pulling economic resources and fight back." We've witnessed the fight against COVID-19 in Africa in the spirit of Tuko Pamoja, Swahili words for we are together, but with a deep sense of togetherness, a sense that transcends mere agreements, but implies empathy and understanding amongst the people. On today's episode, we highlight impressive charitable work that Africans on the continent and abroad have done to assist their own in times of need. Welcome to this conversation. This is Our Voices. I am Orion Itangishaka. We begin in Nigeria, one of the countries with the most affluent private sectors in Africa. The sector, which includes businessmen, philanthropists, banks, and oil companies, which has made impressive contributions in the fight against COVID-19. It is reported that state-owned Nigerian Petroleum Corporation gave $30 million to the Nigerian Center for Disease Control to improve patient care, medical supplies, and equipment. The United Bank of Africa Foundation provided $14 million to support efforts locally in Nigeria and in countries where it has operations in Africa. And then there was Cat COVID initiative. In late March, as the numbers of infected patients began to rise in Nigeria, a coalition against COVID-19 known as Cat COVID was born. This effort, led by Aliko Dangote, Africa's wealthiest businessman and our philanthropist, together with other key players in the private sectors, came together and raised over $84 million so far, with the Central Bank of Nigeria and Dangote donating $5 million each. I had the opportunity to discuss this further with Ms. Zuera Yusufu, Managing Director and CEO of Aliko Dangote Foundation. I began by asking her, what does the $80 million been able to accomplish so far?
So the $84 million that we've been able to raise have primarily gone into three areas of focus. The first area is on testing. So we've been very active as half of it to really purchase some of the Roche supplies, some of the Cepheid, and some of the Abbott testing supplies. Part of the challenge there is that we are competing in the global marketplace. So we were originally on track to only receive, for instance, from Roche, 38,000 cartridges. With our intervention, we were able to boost that number up to 300,000. Part two was we needed isolation centers across the country. Across all 36 states in Nigeria, we sent them enough beds and materials to set up a 100-bed isolation center. And then the third part was palliatives for food. We unfortunately don't have, stimulus packages or safety nets that allow poor people to go and, get a check from somewhere to enable them take care of their day-to-day.
Nairametrics has recently reported that Cat COVID has been able to set aside about 23 billion naira to be used for food relief. Apparently we'll be able to help about 10 million vulnerable Nigerians. How is that effort going so far?
What we've done is we decided that it was important to really look at what we call here the bottom of the pyramid. So the 5% poorest people in Nigeria. That comes out to 10 million people, 1.67 million households. And what we decided to do was for each of those households, 1.67 million households. We're going to buy for each of them a 10-kilo bag of rice, 2 cartons of pasta, sugar, salt, gari, semovita, basically the food that we eat here in Nigeria. That's what we're buying for these 10 million families. Part of the challenge was the logistics, and the quantities were huge. And we were asking them to do this in a time where everything had been slowed down. So the lockdowns meant that, people were they had to do all these, social distancing and spacing in the factory. They have fewer trucks on the road because of the closure in between states in Nigeria. So those are realistic challenges that we had to overcome. For the medical materials, same. I remember us ordering these respirators 10 days because everybody in the world was trying to get this. We're getting delivery deadlines of like 12 weeks and 14 weeks. So some of it we were able to circumvent because of our relationships.
Are the foundations that you're working with, including your foundation, doing similar work, maybe through cat COVID in other parts of Africa, or is it just Nigeria at the moment?
So our the way we were approaching the continental-wide effort, which we're part of it, we're talking to the African CDC, we're talking with we're involved with the work that Strat Masi was doing with creating the purchasing platform for the continent. So we're involved with what's going on the continent. We have a huge private sector here. I would say, bigger than what we have in most other sub-Saharan African countries. But the idea was, let's get the model together here first. Let's make sure that we know what we're doing and we know how we can replicate this outside. And that's exactly what we're doing. And we're also looking at how do we invest in local, African scientists are coming up with all kinds of things that we need to pay attention to. And right now we're working closely with the African Development Bank, who's looking to fund African-led investments and efforts, and who's making PPEs in Africa that are, up to code, who's working on a vaccine. Like, let's support those people, because at the end of the day, we have to rely on Africa a lot more than we have in other crises, because everybody's in a crisis right now, and they're looking at themselves and looking on how, looking to solve their own problems and not ours.
Now to Morocco, where King Mohammed VI is expressing solidarity with his African counterparts in fighting COVID-19. In his quest to promote joint African action to counter the current outbreak, he is sending shipment of medical equipment to 15 African nations. The medical aid is made of nearly 8 million face masks, 900,000 face shields, 600 hygiene caps, 60,000 protective clothing, and much more. These medical gears and products are made in Morocco and in line with the World Health Organization standard. Now we go to Kenya, in East Africa, where in the capital neighborhood of Kibera, Africa's largest urban slum, those who live on a day-to-day wages have been hit the hardest by the coronavirus lockdown since March. The Adopt a Family campaign connects well-off Kenyan families with those in need during this pandemic.
3 months ago, 43-year-old Annete Okumu, a mother of 6, was running a cake-making business on a busy street in Nairobi, and her husband had regular work as a painter. Then Kenya's Minister of Health announced the country's first coronavirus case. Less than a week later, no one was buying cakes from Okumu, and her husband stopped getting jobs. Okumu's child, born with sickle cell anemia, started to get sick after several days of not taking medication.
At this time there's no food, there's no breakfast, no lunch, no supper. For 2 days, I wondered, what next? Am I going to lose my kid? So when I saw Adopt a Family, it was late at night through social media. That is when I decided, enough is enough, let me speak out.
Annette called the number on the Adopt a Family Facebook page. Moses Omondi picked up the late night call and asked Annette to meet him the next day.
The idea, Adopt a Family as an initiative, basically started towards the end of March, when the government had issued the directive of stay at home, social distancing, and avoiding physical contact. Basically, it led to many of the employees, closing shop in order to adhere to the directives. In the process, there are people who are relying from hand to mouth, these to manual labors and stuff.
On the night that Annete Okumu made a call to Omondi, Joe Bitange, a video editor in Nairobi, was on his phone reading about the Adopt a Family initiative. Bitange reached out to Omondi the following morning and was connected to Annete Okumu. Soon, Okumu's family had their first meal in 2 days.
I decided to support one family by giving them a voucher. And he told me that the voucher that I gave him was actually supposed to support the family, to feed the family for 1 week. Yeah, so come the second week, I also gave him another voucher. And very many people now came in because they knew I was part of the program, because I was among the first people who joined his team.
In less than 3 months, the initiative has connected 460 families from the slum to another 460 families who give them financial support. In early March, following a stampede in Kibera that killed 2 people, the government said it would pilot a cash transfer program to help the most vulnerable members of society buy food during the COVID-19 pandemic. Many Kibera residents say they have not received that cash, however. Government representatives in Kibera say they are doing their best to help the needy during this time, and that personal initiatives such as Omondi's are important in filling gaps.
So far, the government has done very well. But you see, you cannot do it alone. You need partners. And this is why we say the likes of Omondi are the best in the world.
Apart from direct money transfers, Adopt a Family conducts food distribution drives for needy families. They also run a feeding program for children in the slum where Annete volunteers her time cooking. Luol for VOA News, Nairobi.
When we return, my co-host Luol will give us a glimpse of the charity efforts being made by Africans in the diaspora in the quest to help one another. Also, I speak to All-Star former basketball player Luol Deng about his efforts to help people in the motherland. Don't go anywhere, we'll be right back.
Being part of Our Voices is about more than just sitting here and talking about women's issues. It's about listening to them
and bringing their opinions to the table and making sure their voices are heard.
Because our lived experiences, our stories, and our voices will help shape the next generation.
Welcome back, You With Our Voices. We know that the coronavirus has forced organizations around the world to shut down, but some African diaspora-led organizations were not intimidated by these challenges. My co-host Luol brings us the story of how some Africans are still striving to help other Africans.
Like millions of Americans, Somali American business owners in Minneapolis, Minnesota, are greatly affected by the coronavirus pandemic. And as the U.S. saw the unemployment rate skyrocket, community leaders got together to create a task force to address challenges.
So what we did is we sit down, we literally had to have resource centers, even though everything was being done through virtually. We had teams of people who were dealing with legal matters. So we have lawyers on our task force. We had doctors who were dealing with the public health issues and the questions that were coming out and educating the community and creating that awareness. We had the business community who were dealing with policies.
There are other diaspora-led initiatives like this one in other parts of the country. The Ethiopia Diaspora Trust Fund, together with the Ethiopian government, created a COVID-19 mitigation plan to work toward easing the impact of the pandemic at home. The Luol Deng Foundation, a nonprofit that organizes basketball camps and community events, also had to find new ways to reach their communities. But how do you organize an event during the pandemic? The team, recognizing a desire for community, moved their operations online.
One of the things that also stood out for us doing things virtually is that we can include people worldwide. So we've had in the pseudo-link Zoom that we've had people calling from different corners of the world, right? So we've had a young lady who had just graduated school calling from Saudi Arabia. We had people calling from Dubai. We had people calling from China, India, England, Australia, you name it. It's an incredible world for us to now not expect people to always kind of buy a ticket to go somewhere. So those who can't afford it can always take part of things like that.
And even during a time of social distancing, Arek Deng, the CEO of the foundation, says they feel closer to their community.
As you've heard, one of the foundations from the diaspora assisting on the continent is the Luol Deng Foundation. And if you don't know who Luol Deng is, he's a South Sudanese-born 2-time NBA All-Star who recently retired from the game as a Chicago Bulls player. I had the pleasure and the opportunity to talk with him about the works he's doing to help others during this pandemic and the tips he has for those in the diaspora who wants to do the same. Take a listen.
In the past, I've worked with UNICEF, I worked with the World Food Program, and I've learned a great deal. A while back, we had a crisis in Luol, South Sudan, where there was a fire in the village, and a lot of these charities couldn't get there. And I found a group of people down in South Sudan. Some are family, but some are people that very working hard. And what we did was we were able to provide food and help people through the tough time. But now fast forwarding with COVID, it really helped us to have people on the ground that we are relying on. So we wanted to come in and really focus on providing food. So what we're doing with our foundation is how can we feed families for weeks and weeks, knowing that this might go on.
So as a member of the diaspora, how important is it for you to be able to go back to South Sudan and help in your community?
No, it's very important. I think, not just being South Sudanese, but being African in general, I think it's very important for us that we set example. There's many ways of becoming successful and making money. But what makes you unique is how can you touch people differently besides the one thing that you did. For me, I really want to challenge myself in opening doors and so many other things. I could put people in a position that could really, help these youth and diaspora, especially the young kids back home who are not getting opportunities. How can we set up a platform that gives them a path to become, whatever they want to be?
What advice do you have for others in the diaspora?
First, you have to study what are the issues or what are the challenges, and you'll find many. But then you have to, cut it down to what do I want to help with. I'm always trying to teach people that there's places in Africa that you could actually, with $100, you could pay for a whole tuition for a whole year for a student. $200 and you could get them books and uniform. It's really important that we take on the responsibility, just understanding that helping one person is important as me being capable of helping 20 or 30,000 kids.
What are some of the heartwarming messages you're getting from some of the youth that you're working with, in South Sudan that helps you and pushes you to continue to do what you're doing and helping them?
We've been doing it for years now, and it's always just about exciting every time we see, the opportunities that these kids are getting. We can make kids happy, make families come and thank us for, their kids being able to have a dream and to actually go out and try to, make it happen. At the end of the day, for us, whatever you're going to be, we're proud of you. It's not necessarily have to be one thing that you're labeled as. It's getting an opportunity to be great.
What's next for Luol Deng?
No, there's a lot. I'm working with the NBA and the new Basketball Africa League. That's something that is really important to me in terms of providing a platform not only to have the league in Africa, but also to challenge these teams to have youth programs for boys and girls. We're working on, real estate construction company in Uganda right now, where we're trying to build affordable homes. Also including, everything that we are learning outside of South Sudan. How can we bring those experiences back and help our younger generation? We'll never get the opportunities to get the education that we've got. So, it's a lot of things, but it's really what keeps us going, and then the foundation work.
We have to take another quick break. When we return, we take a look at international as well as continental initiatives being done to assist the most vulnerable during this time. Stay with us. Welcome back. This is Our Voices, and thank you for being with us. The United Nations is boosting its global appeal, asking for about $7 billion to avoid a devastating fallout against the COVID-19. The UN's emergency relief chief tells VOA that the updated plan to fight the coronavirus will target 9 African countries such as Benin, Djibouti, Liberia, amongst many. VOA diplomatic correspondent Cindy Sain reports.
$1 billion has been raised since March, and the United Nations is asking for more to aid poorer countries battling the coronavirus.
We have made a good start. Now we must build on it.
The UN plan prioritizes about 50 countries in Africa and the Middle East, but also places such as Venezuela, Haiti, and Bangladesh, where there are large numbers of refugees. UN Relief Chief Mark Lowcock told VOA.
So what makes those kind of places vulnerable is, firstly, they have extremely weak health systems, so their ability to cope with a deadly virus like coronavirus is very weak. And secondly, their populations, in many cases, millions of people, are right on the verge of survival.
Other relief leaders warn that action and money are needed now from wealthy countries and wealthy individuals.
What we're facing now is a double pandemic of truly famines that could impact us in biblical proportions.
Beasley is in Washington for meetings with U.S. Secretary of State Mike Pompeo and congressional leaders. He and the UN's emergency relief coordinator believe taxpayers in the U.S., Germany, and other countries with more means will meet the challenge. Cindy Sain, VOA News.
So what can African nations do to be less dependent on foreign aid? Haiti Adams Fitzpatrick speaks to Angèle Okumu. She's an author and an international trade expert. Haiti begins by asking Okumu, what can African countries do to be less dependent on foreign aid?
Number one, we need to produce and consume African products. Our public sector, our government, we need to create the environment that will be conducive for citizens to produce and consume what they produce. Because the borders are closed anyway. So now we are faced with the side reality to find other alternatives on supply that we need for regular needs. So like, toothpick, soap, things that everybody needs on a daily basis. You can't import it anymore, and which is not bad. Those are the things that we can produce locally. So we need to improve our manufacture, value chains, reduce export of raw material, transform the product here before you export. Even if you don't export, the African market is huge. 1.2 billion people. So last year they signed the Continental Free Trade Agreement area. We have one single market. We can produce one product here in Cameroon and sell it to Nigeria, and vice versa. So I think it's time for African leaders to think inwards, find African solutions to African problems, and actually we have no choice. And so I'll tell you, intra-Africa trade, manufacture, produce local products, invest in infrastructure, and infrastructure is the underpinning that we need to build all the sectors. Including the agriculture, the transportation, is the infrastructure. You cannot process your tomato if you don't have any power. You cannot address your health issue, there's no power. You cannot address education issues, there's no power. We need to invest heavily in energy, infrastructure, and make sure we enhance our manufacturing capability and produce locally for the African local market.
Now, this discussion around aid versus trade has been around for a long time, and with many inside Africa pushing for an end to paternalism and patronage. What would you say is the path to partnerships for African countries?
We need to have policy that empowers African private sector and help them go into partnership with international companies. That's the only way we can really found a strong partnership. Because government, they create the environment, but politicians, they come and go. But the economy stays. So we need to allow the private sector to be strong enough to partner with international companies so that everybody owns all the piece of the economy and the local company stays in the driver's seat. The government sometimes is even coming against local companies because they don't want them to be too successful and make too much money and have maybe influence on the government. I think it's a big mistake, especially in some Francophone countries and in Central Africa, I must say. But now if you go to Senegal, Cote d'Ivoire, you have very Senegalese or Ivorian, Nigerian businesses that are going international. They have investment in Latin America, in Turkey, everywhere. But in Francophone Central Africa is still very bureaucratic, and it's the vestige leftover from the former colonial system with all those bureaucracy and the issues controlling everything. We need to loosen up, to regulate, allow the private sector to play their role.
Now we share with you one woman who we are watching in our Women to Watch segment this week. In the DRC, one young woman is helping women and orphans to protect themselves from the coronavirus.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common in urban or downtown areas. But getting that information to people who have no access to water, electricity, or money can be a challenge.
An orphan of military parents herself, she runs the aid group Telema Mwana ya Mapinga, or Stand Up Child of the Military.
Pourquoi nos parents sont prêts?
How come our parents are ready to die helping protect our country, its territory, people, and riches, and at the end of the day, we are the poorest and most vulnerable and miserable? And poorest among the poorest, most destitute among the most destitute are the widows and the orphans.
The 26-year-old is visiting the camp with her team to distribute face masks and show people how to use them and how to wash their hands for the time it takes to kill the virus.
That's all for us this week. On behalf of my co-host Haiti Adams Fitzpatrick and Ayan Bior and everyone here at VOA, thanks for watching. Good day.